morning, everybody. My name is Dr. Susan Wanjiko. Today we are going to be talking about the microvascular complications of diabetes. And to put it simply, these are the damages to the tiny blood vessels of the eyes, the kidneys, and the nerves. So the key message that I want to occur at the end of this video is that the early stages of this disease are silent and screening is essential. So when we start with diabetic retinopathy, this is when blood vessels in the eye become weak and they leak. Often, early there are no symptoms, but with time the patient may develop blurring of vision, visual loss. So again, we should screen any patient with diabetes every 12 months. But if we already find they have established retinopathy, we should screen them every 3 to 6 months. When we move to diabetic nephropathy, this is when our kidneys have filters. So when the damage happens to these filters, we find that protein leaks in the urine. It is also a silent disease, so screening is essential. Again, we should screen our patients every 12 to 6 months by doing urine tests, and every 3 to 6 months if you already find that the kidneys are already damaged. For diabetic neuropathy, our patients will come with tingling sensation of the feet or of the extremities. Also, they will come with numbing or burning pain. And our patients also, because of loss of sensitivity, they are at a higher risk of developing foot ulcers. So we advocate for foot exams every 12 months. And at every hospital visit, we should always do a foot exam and look if their feet are already starting to develop ulcers. So how do we prevent these complications? We should always keep our glucose within targets, and this is doing random blood sugars, and also every 3 to 6 months doing the glycated hemoglobin levels. We should also control our blood pressure and cholesterol. We should also avoid smoking, and with the new WHO guidelines, we should, if a patient is already taking alcohol, we should work towards stopping alcohol consumption. I will not overemphasize the need for attending yearly screening sessions for any patients with diabetic, and also ensure that if you're already diabetic, you are taking your medication consistently. Thank you so much, and we will continue discussing further on this topic with time. Thank you.